This is a 55-year-old patient who presented with visual symptoms on the left side. MRI was done for her, and it showed this mass. This is an axial thin cut T2 with fat saturated images through the orbits, and you can see this mass lesion which is within the extraocular muscles. So this is what we describe as an intraconal lesion. It is surrounding the optic nerve, which you can see optic nerve on the side of this tumor. It is not causing major compression on the eye globe. It remains within the intraconal space without extension to the optic canal. On the coronal images, you can see that the optic nerve is on the side of this tumor. It has, as we mentioned, a slightly bright signal on T2, but more like iso-intense signal to brain parenchyma. This is T1. This is FLAIR image, and again it shows the iso-intense signal on it. It does not have any diffusion restriction. It is iso-intense to the parenchyma. Now on the post-gadolinium images, we see that this tumor is strongly enhancing. Again, it is separated from the muscles, and it is encasing or the eccentric to the optic nerve. And you can see over here that the optic nerve passes partially within this tumor, but it is not involved. It's isolated. You can clearly isolate the optic nerve from this tumor. These are important findings in the differential diagnosis, because tumors within the muscle cone, usually you would consider either meningioma, which this case is because it is eccentric and it is not involving the optic nerve, or the optic nerve glioma, which typically is more fusiform because it involves the optic nerve and it's usually at the length of the optic nerve. So this is a solid tumor, strongly enhancing, not involving the optic nerve directly, is consistent with an optic nerve meningioma.